Kevin Jefferson here, the DC Foot Doctor. This next case presents a patient who is on anticoagulant medication for his heart disease. Anticoagulants are also known as blood thinners. What this case demonstrates is what can happen when folks on those types of medications injure themselves. Check this out. A hematoma is a localized collection of blood due to the rupture of blood vessels under the skin. This typically happens after blunt force trauma. The skin is not cut, so the blood escapes into the surrounding soft tissue. When a boxer gets hit in the face and his eye swells shut and turns black, that's a hematoma. In this case, the gentleman had been taking blood thinners for some time, so he was at a higher risk for this injury. He bumped into a table and didn't think much of it. A couple of days later, he noticed increasing swelling, darkness, and pain in his lower leg. Depending on the size and number of blood vessels injured, a hematoma can form very quickly or take a day or two to be noticed. A local anesthetic was injected around the area, so he had no pain. No tourniquet is used, so any ongoing bleeding can be discovered. After the small skin incision and blunt opening of the hematoma, you can see the large amount of dark, thick blood as well as clumps of blood clots. As the injured vessels continue to bleed, the escaped blood is no longer oxygenated, causing the dark color. The removal of the clotted blood is called evacuation of hematoma. A small amount of blood will be resorbed by the body, such as with bruises. However, a large hematoma must be handled surgically. The patient may be at risk for infection, severe pain, loss of nerve function, or continued blood loss without evacuation. Worst-case scenarios include compartment syndrome, a severe increase in pressure in a limb leading to muscle loss and possible gangrene. A small piece of clot may re-enter the bloodstream and travel to other parts of the body, causing injury and, in rare cases, death. Blunt dissection and evacuation are continued until blood clots are no longer seen. Here we see that blood clots still remain. Further blunt dissection and evacuation confirm that all blood clots have been removed, with only liquid blood coming through the incision. Sterile saline is used several times to flush out any remaining blood clot that may have been missed. Now that the dark blood has been removed, any deeper active bleeding can be seen. Fortunately, there was none in this case. Because the incision is so small, only one suture is needed to close. The patient is sent home with a prescription for pain medication and instructions to rest, keep the leg elevated, and to apply ice packs. The suture is removed in 2 weeks. Anticoagulant medications, or blood thinners, are very important in the treatment of heart disease, stroke, and blood clots throughout the body, such as deep vein thrombosis in the legs, also known as DVT, or pulmonary embolism in the lungs, known as PE, which can lead to death. However, those taking these medications should take precautions. Be extra careful shaving and using knives in the kitchen. Use a soft bristled brush to brush your teeth. Always inform medical and dental providers that you're taking this medication. If you should injure yourself, even if it seems insignificant, take immediate first aid and observe the injury closely for a few days. If things look like they're getting worse, see a doctor right away. Oh, in case you were wondering, podiatrists in Washington, D.C. are licensed to treat soft tissue injuries and ailments of the lower leg as well as the foot. Check your state or country for the podiatry scope of practice. Thank you for watching this video. Like it with a big thumbs up and subscribe to the channel. Until next time, take care of your feet.